สวัสดีค่ะ My name is Sininath Muangthong. I am a clinical pharmacist at Bangkok Hospital, Phuket. So, for today, I would like to talk about patient's instruction for coronary artery disease. So, there are 5 types of medication used in coronary artery disease. The first one is antiplatelets. The second one is statin. The third one is beta blocker. And the fourth one is ACEI and ARB. And the last one is Vasodilation. So for the first one, antiplatelets. Antiplatelets help to decrease platelet aggregation and inhibit thrombus formation. So they are widely used in primary and secondary prevention of thrombotic cerebrovascular or cardiovascular disease. For the first types of antiplatelets, aspirin. There is 81 mg of aspirin, and in Bangkok Hospital, Phuket, there are 2 brands. The second one is clopidogrel. There are 2 brands of clopidogrels, which are Plavix and Apolet, 75 mg. The third one, ticagrelor. The fourth one, Vasodilation. The precaution of antiplatelets. You have to take antiplatelets after meal immediately because the medicine can irritate your stomach, and drink plenty of water. The second precaution. Beware the interactions between medicine and also the interactions between medicine and supplement such as fish oil and ginkgo biloba. These 2 kinds of the herbs can cause increasing the risk of bleeding. For ticagrelor, for precaution, headache, weakness, and dyspnea can cause. The side effect of clopidogrel, stomachache and diarrhea. The second group of medication, statin. Statin is anti-lipidemia. It reduces the inflammatory at the wall of the blood vessel. So there are 3 types of statin. The first one is atorvastatin. The second one is rosuvastatin. And the last one is simvastatin. For precaution of statin group, the statin group can cause a side effect to the liver and muscle. It means that unspecified muscle pain, less urine or dark urine. If the patient has these symptoms, you have to consult to the doctor. And you can talk to your doctor or pharmacist for more interactions of the medicine. The third group of the medicine is beta blocker. Beta blocker reduces heart rate and heart contraction. It can keeping balance between heart working and oxygen intake. For beta blocker, there is 4 types of the medicine in beta blocker group. The first one is bisoprolol. So there is 2 strengths of bisoprolol, 2.5 mg and 5 mg. The second medicine is metoprolol. The third medicine is atenolol. So there are 3 strengths of metoprolol, 25 mg, 50 mg, and 100 mg. And the last one is carvedilol. For precaution of beta blocker, immediately stop taking medicine may increase risk of chest pain, fasting heart rate, and high blood pressure. High risk of fall or orthostatic hypotension can be occur in the first episode of taking medicine. The fourth group of the medication used is ACEI and ARB. So this group of the medicine can dilate the blood vessel and reduce the blood pressure. It can prevent the mortality and complication. There is 3 types of the medicine used in Bangkok Hospital, Phuket. The first one is losartan. The second one is Ramipil. And the third one is enalapril. The precaution of ACEI and ARB. dry cough. If it is too much, then you can contact your doctor for more consideration of checking the medicine. Other side effects could be low blood pressure, dizziness, headache, high level of potassium. High level of potassium can caused by the sign of nausea, abnormal heart rate, and muscle weakness. And the fifth group of the medication used is vasodilation medication. The vasodilation medication dilate vein and artery. So there is several types of dosage form of vasodilation such as injection, sublingual, spray, patch, and pills. For the first one of vasodilation medication, it's used for taking in daily life. The first one is isosorbide dinitrate and the second one is isosorbide mononitrate. And the second dosage form is sublingual form. For precaution of vasodilation medication, the medicine can cause dizziness, hypotension, or fainting. So you have to be careful when you're changing the position. For the sublingual form, you have to sitting down while taking this medicine because the medicine can cause hypotension or lowering the blood pressure. The way of taking sublingual, if you got chest pain, you have to place the sublingual under your tongue. After 5 minutes, if you still have chest pain, you have to take the second one, to place under your tongue, the second one. After that, 5 minutes, if you still have the chest pain, then you have to place the sublingual under your tongue, the third pills, and then you have to go to the hospital. And one thing to remember is, if you place the sublingual under your tongue, you have to feel stinging sensation. If not, so the sublingual may lose some of the strength. If you forget to take the medicine at the right time, so take the medicine as soon as you remember, unless it's nearly to the next dose, so you have to take it next dose. Do not take double dose to make up the forgotten dose. But the most important thing is take the medicine at the right time. When you have to meet the doctor, chest tightness is the characteristic symptom of ischemic heart disease. The chest pain may spread to your arm, shoulder, jaw, or back. Angina can be triggered by exercise, excitement, or emotional distress, and it can relieve by resting and taking the medicine. Dyspnea, dizziness, fainting, or unconsciousness. And this is the end of the patient instruction used for coronary artery disease. If you have any questions, you can contact us here or call 1719. We hope that you get a lot of knowledge. Thank you so much.